Thank you, everybody, for joining us for the MacTel Type 2 Community Forum for sharing knowledge and support. My name is Kira Baldonado. I am the Vice President of Public Health and Policy at Prevent Blindness, and I will be moderating this forum. For those attendees today with low vision, I'll provide an audio description. I'm a middle-aged white woman with medium-length brown hair curled, and I'm sitting in my office. On one side is patterned wallpaper, and behind me on the other are some decorative shelves. Today, we'll learn about MacTel Type 2, understand the patient perspective from two individuals living with MacTel Type 2, and learn about some resources available to those living with the condition. First, I'd like to thank Neurotech Pharmaceuticals for sponsoring this event and making the education shared today possible. Today's webinar will be recorded, and it will be posted on the Prevent Blindness website in the coming days. Everybody who registered for this webinar will get a notice via your email when it is posted. And now I'd like to introduce our first presenter for this forum, Dr. Barbara Blody. Dr. Blody is a medical retina specialist from the Department of Ophthalmology and Visual Sciences at the University of Wisconsin-Madison. Dr. Blody will provide an overview of MacTel Type 2. Afterwards, we'll take a few minutes for questions with Dr. Blody, and you can submit those questions through the Q&A function at the bottom of your screen. We'll respond to as many questions as possible, of course, as time allows. And please note that the information being shared in this webinar is for educational purposes only. It's not intended to serve as medical advice or to endorse any specific product or treatment. We do recommend that you consult your healthcare provider if you need personalized medical guidance before making any decisions regarding your health or treatment options. We encourage you to reach out to a qualified medical professional who can address your individual needs. And now, I'd like to turn the presentation over to Dr. Blody.
Thank you, Kira. I will share my slides with all of you. Welcome. It's really quite an honor to be able to share some time with you and talk to you about MacTel. My name is Barbara Blody. I'm a medical retina specialist, the Department of Ophthalmology at the University of Wisconsin in Madison, where I've been for 27 years. If I could I'd like to visually describe myself as well. I call myself a woman of a certain age. I have short brown hair. I am Caucasian, and my background is also my home office. I would like to start off kind of describing what MacTel is. I know that many of you in the audience have MacTel and you're familiar with this, but just to go over the origin of MacTel. MacTel, the word MacTel, is actually a fairly new name. It was originally called Macular Telangiectasis and was also called idiopathic juxtafoveolar telangiectasis. And that was as described by Dr. Donald Gass, who you see on the right. That was too long of a name. And even macular telangiectasis became quite long. And so for really everyone's best interest, we used the term MacTel. And that started 20 years ago. So 20 years ago, we used MacTel because of a new research consortium, a research study called the MacTel Project. And this research is funded by the Lowy Medical Research Institute in La Jolla, California. And I think it's important that we really talk about what this MacTel project has done and what it is. It is a global collaboration of researchers, both basic scientists and retina specialists, the clinicians, and started out by trying to accurately describe this disease and to look at genetics and other possible causes of this disease, and to start with, to keep a registry of MacTel patients, which simply means patients with their permission. We would keep a list of the patients and their images of the retina. And this has then developed into clinical trials that have studied possible treatment for MacTel. So that it's been a very fruitful collaboration. It's very meaningful to be able to work with scientists as well as clinicians. So to just tell you a little more about MacTel, at least in this country, the United States, MacTel is diagnosed in 2,700 patients each year, and affects approximately 150,000 patients, Americans. And those symptoms, as you see on the right, the symptoms first appear for patients in their 40s and 50s. The average age of diagnosis is 63. Okay, so that's quite a bit later than the symptoms. And why is that? Because it does take time. It often takes time for the retina specialist or the ophthalmologist to make this diagnosis. It's very subtle in the beginning. About 2% of MacTel patients are under age 40, and so we need to be on the lookout for that. And we also know that MacTel may start out affecting only one eye for many, many years, but it eventually does typically affect both eyes. The number of patients with MacTel may be falsely low. When we say 150,000 Americans, we're not sure that's the true number because it is difficult to diagnose. So let me go over some of the symptoms, some of the questions that patients with MacTel have. So I do see patients with MacTel, and one of the first questions is, what caused this? What did I bring this on, or what caused this retinal condition? And really the answer is we don't know what causes MacTel. We know a lot more now than 20 years ago in terms of what it looks like, what are the features of this condition, and how does it progress over time, but we really don't know the cause. Patients often ask, how long have I had this condition? And that's a good question, but we really can't pinpoint that either. It probably dates back to when they first had symptoms. And I have patients kind of think back. When did this first bother you? When did you have problems with your vision? And that's likely when this condition showed up. What are the chances that my children will get MacTel? That's a difficult one as well. We don't have hard data. I can't give you a percentage. There are families where MacTel can appear in many generations, but that is not always the case. So it is not always going to be passed on. And finally, the question comes up, will I go blind? The answer there is no. That I can be certain about. We don't see blindness. It can lead to loss of central vision, but patients with MacTel do not go blind. So now I'll share with you, and many of you know this, the symptoms of MacTel. I was going to focus on 3 symptoms that are the most common and what I see in my practice. First is distortion of vision. That distortion can affect the central vision or near central vision and can grow over time. And it's very difficult to live with distorted vision. You see these trees on the tree trunks on your right, and they are quite wavy for those of you who can see that. And it's difficult because the world just looks completely different. The area of distortion can be mapped out. So in our clinic, we may show patients this grid, or it looks like graph paper, where they can then trace the area where they cannot see well, the area of distortion. The other common symptom is blurry vision. Things really just look washed out. I mean, it's very difficult to see what's right in front of them. And it's hard often to define the blurry vision. I find my patients may not always be able, they feel uncomfortable defining it, but it is typically in the central or near central vision. And the vision change, this is important, does not improve with glasses. So going to get your glasses checked won't improve that blurry vision. And then the other symptom that comes up a lot, and I hear from my patients, is that there's a dark spot in their vision. That dark spot could be near, again, or within the center of their vision. It could be in one eye only or in both eyes. And that spot may be gray or black or even kind of an empty spot, and it can grow with time. So that spot is always in the same location. It's not moving or floating around. We have floaters, and those are pretty benign, but it is in the same location, and it can grow. And you can see here, what I'm showing here is a large central spot, dark or black or gray, that blocks vision, and this is difficult. So how do we diagnose MacTel when we see patients? You're in the office. It's difficult to diagnose, and it does get missed many times by ophthalmologists. So I think we're getting better at this, but it's still something that needs to get out there so we can properly diagnose this. We do need to examine both eyes and we do need to dilate. And so those dilating drops, it's not easy to be dilated, but it's the only way that we can look at your retina. What I have pictured on the right is physician examining the retina with a slit lamp. That's the machine you see there. The patient's forehead is up against the bar, and we use a special lens so that we can see the great detail in the retina, and we can often see a color change or some pigment in the eyes of patients with MacTel. So there are signs we can see, but something that's really quite helpful is imaging. And I'm going to show you the two types of imaging that we use most commonly. There's fluorescein angiogram and OCT scan. So fluorescein angiogram on the left shows us the blood vessels in the retina, and those are pictured in white. Those are normal blood vessels. And for those of you who can see, there's a central blue dot in this picture. That's the center of the vision in the retina. The blue circle to the left shows us an abnormal area. That's an area where the blood vessels look like they're kind of forming a network, a little bit lacy. And that's where the MacTel starts. That's where we see this change in the blood vessels in the retina. The retina has many layers to it, and so it's important to know what's happening in different layers of the retina. On the right, I'm showing an OCT scan, which shows us the layers as if we could cut through a cake. We can see the inner and the outer layers of the retina. In patients that have this MacTel condition, there can be sort of absent areas or areas where the retina appears to be missing because there's been some damage. The red arrow shows us a black square below the red arrow. That's in the inner retina. The blue arrow shows us another smaller black area. That's in the outer retina, where those are areas reflect some damage. And that really does help a lot for really making this diagnosis with certainty. Just to wrap up this introduction, I wanted to share some questions that patients ask me about living with MacTel once they have this diagnosis. Definitely difficult to read. So patients tell me it's hard to read and how do I manage? And they also ask, will I make my eyes worse by using them? I can tell you right away that you will not make your eyes worse by using them. That is not possible. So using your eyes is okay, but it can be difficult to read. And on the right here, I'm sharing some tools that might be helpful, some magnifying glasses that have gotten better and better with time. But what I do recommend in order to evaluate what tools might help is to get referred for low vision services. And these are services provided by optometrists or certified low vision specialists. And they're trained to teach patients how to use optical or electronic devices such as iPad and the computer that can help improve the vision you have. How do you get the best possible use out of the vision that you have? And this really does usually take a referral. So from the optometrist, from the clinician's office, the retina specialist or the ophthalmologist, we would refer you to a low vision specialist. So where do we go from here? My goal would be that we continue as physicians to listen to our MacTel patients. Our MacTel patients can help us understand this condition. We need to continue to gather information on the long-term prognosis for our patients with MacTel, what happens over the years and decades. And I think we're going to hear in the next year or so some results from clinical trials that could provide treatment for MacTel. So very much appreciate being able to share this, and I'm going to open this up uh, to some questions.
Thank you, Dr. Bloody. That was a wonderful overview of a condition that is near and dear to many of our participants' hearts right now on this webinar, but also that many people need to learn more about. So your presentation brought out a lot of questions, and we did receive a lot ahead of time as folks registered for this webinar. One of the things you said throughout the presentation is we need to learn. So as a clinician, how do you stay aware of research about MacTel type 2? What steps do you take?
Yeah, I do go to meetings where we discuss this condition, and researchers, whether they're ophthalmologists or basic scientists, they will share their research, they will present, and then there's usually time for discussion. So it's important to hear what the latest data is. And eventually, what we want to see is that that data is published. And there we really can consider that sort of the forefront of the field when we look at the new research that's published in journals.
That's great. And getting that published research is really critical. One of the pieces that or the questions that came pretty commonly to us in scheduling this webinar is the issue around supplements. There are many advertisements for supplements, and there's many offered. Is this something that's appropriate for MacTel type 2 patients? And if so, how do they know they're safe? There's a lot of information to swim through out there.
Yes, that's a really important question. I don't recommend supplements for my MacTel patients. I know there's in the news some new supplements that are being considered, but we really would want to see some data where we could compare patients on supplements to patients that are not on supplements and see over a period of time, see if there is a difference. Do those supplements help? There is very little regulation of supplements in the market. They're not subject to the scrutiny of the FDA. So I would check with the ophthalmologist and even your family or your general doctor to make sure that these supplements are going to be safe.
Yeah, thank you for that guidance. And at Prevent Blindness, we like to consider the whole person. And oftentimes, individuals have conditions beyond just MacTel type 2. They can have other chronic conditions, diabetes. I know they may have other eye conditions as well. So um, let's look first at those chronic conditions. Does having something like diabetes increase or impact the MacTel type 2, or is one connected to the other? Or are these two different things to consider for individuals?
Yeah, this is a good question as well. There is an association and between diabetes and MacTel, but I'm carefully choosing my words because association means there is, among patients with MacTel, a higher percentage of patients of these MacTel patients have diabetes, but that is not a cause. We cannot say that one causes the other. It's really an association, and we really have yet to figure out and understand why. I can tell you that diabetes does affect retinal blood vessels. This condition affects retinal blood vessels, but it's very different. This is not diabetic retinopathy.
Yeah, interesting. And considering those individuals who may have, say, cataract or glaucoma, those conditions also require some surgical interventions. Are there things to consider with somebody who has MacTel type 2 if they're recommended for cataract surgery or something else? How do they navigate these different conditions they may have?
Yeah, that's a great question as well. Most most all ophthalmologists and including the retina specialist will check the pressure in the eye when the patient comes in, and so that we have a record of pressure. If the pressure is regularly high, then they may need to be evaluated by a glaucoma specialist. Cataract is also something that retina specialists would check on, and if cataract is developing, we would refer the patient for cataract surgery. The two, though, are independent. They're not related to the MacTel. We just would want, there is treatment for glaucoma, there is treatment for cataract, so we'd want the patient to get to those specialists as well.
Okay, so keep up with your eye doctor
Yeah.
appointments, have a conversation, and follow the recommendations, it sounds like. Are there, people want to be active with their eye health. So are there things that they can be doing lifestyle wise, changing in diet or exercise approaches or anything that patients with MacTel type 2 should consider in those areas?
Yeah, I wish there was something I could say that would help diet or exercise. We don't know of any specific diet or exercise. I tell patients that a healthy lifestyle does help our eye health. We know that definitely for macular degeneration. This, however, is not macular degeneration, but in theory, keeping an active lifestyle and a healthy diet, I think will do something to help support your eye health.
Okay. Hopefully it can't hurt. That's for
Correct. Exactly. Exactly.
And one of the things you mentioned at the beginning of your presentation was around the genetics of it. So is this, just to reiterate, something that can be passed down in a hereditary format? Is that something that people need to be worried about or have conversations with family members?
It can be. There's been really good research done at the University of Utah by Paul Bernstein, where he has followed families, and multiple generations have had MacTel, but that is not always true. So we do know some of the genetic types that we can look for, but actually it's not just one gene. So there's multiple genes. We don't know all the genes involved, and we end up we end up just saying we don't have enough information.
Okay, so it sounds like everybody needs to be aware of what's happening with their family, stay educated, involved in research as much
Right.
as possible. That's what's needed with this condition right now. So great.
Exactly. Exactly.
Any parting words, Dr. Bellitti? I know you have another engagement this evening, so
Yeah.
you have to run away as well. But anything else to share with our audience?
Yeah, I would say really just, try to use all the tools that are available for you to be able to maintain a normal lifestyle. It is a slow, generally speaking, a slower moving condition. So that can help in some patients, but I also know that the symptoms are severe when you're in your 40s and 50s and 60s. It is very difficult to live with distortion and blurry vision right in the center. So we're all hoping for some good treatment, but also I hope that you can just keep going, keep working, and looking, doing the best that your vision can offer.
Wonderful. Thank you so much for being here tonight, Dr. Bloody. Great information, and hope to hear more from you in the future. Thank
Thank
you.
you, Kira. Thanks so much. Bye-bye.
And with that, I will move on to our next portion of the evening. I'll make sure I'm sharing the correct slide. There we go. Okay. And now I am pleased to be able to introduce our panel presentation this evening. With that, I'd like to welcome three individuals. Julie Grutzmacher, Director of Patient Advocacy and Population Health Initiatives at Prevent Blindness. And she'll lead a discussion with Len Pilon and Dr. Tiffany Troso, two individuals who will share their personal experience of living with MacTel Type 2. Just a reminder, before we start this segment, we will have the remaining speakers here in this panel and myself available for questions and answers for about 10 minutes at the end of the session today. And again, you can submit those questions that you may have through the Q&A function. You guys are doing a great job of doing that already. Please keep it up, and we'll respond to as many as we can at the end of the session. And with that, I will stop sharing and turn it over to Julie.
Thank you, Kira. Welcome, everyone, and a special welcome to our panelists, Len Pilon and Dr. Tiffany Troso. I am a white woman in my early 40s. I have long, brown, curly hair, and I am at my home office with lots of plants in the background, a mirror on the wall, and a painting. So let's get started. Len, I would love to start with you. So tell us about your experience with diagnosis and the time leading up to that.
Oh, thank you. For a quick description, I am a Caucasian and I am wearing a check shirt. The background is a rooftop in Chicago. I am in my late 60s and sliding into retirement.
Wonderful.
And so ask the question again, Julie.
So tell us about the time around diagnosis and leading up to that.
Yes, absolutely. I experienced something basically when I went in for an ophthalmology appointment. We went in and I had new prescription lenses made, and I put them on and I was not seeing very well. And we figured the lab probably made a mistake on the lenses. So they remade those and they checked them several times. And my ophthalmologist basically said, Len, I think that maybe you need to go see a retina specialist because I don't think there's anything that we can do, to help you with that. So I was sent to a retina specialist to diagnose what the issue was. The interesting thing is I was close to 63 years old, just the data that they presented earlier when I found out all of this was going on with me. So that there is a strong correlation with the data shared earlier.
Thank you, Len. How about you, Dr. Trosso? Tell us about the diagnosis and the time leading up to that.
Sure. So I just want to give a quick description of myself. So I am a middle-aged 55-year-old female, have brown hair with some blonde highlights in it. I am wearing a black dress. I am sitting in my office with the background blurred because it's a big mess. So you just see blur behind me. I am a physician. I was diagnosed when I was in my early 40s, but again, somewhat like Len's experience, they had trouble figuring out why they couldn't get my prescription just right and why they couldn't correct my vision. Interestingly, I believe this started much earlier. My third child was born when I was 38 years old. And after a very difficult delivery, which ended up in a C-section, I was put back in the recovery room and was not able to see the clock on the wall. When I looked at the hands of the clock in the middle, or if I looked at each of those numbers, I wouldn't be able to see the number that I was looking at or the center of the clock. And they actually were very worried that I had a stroke or something. And they sent me, I had an MRI and I saw lots of doctors and neurologists, and they weren't able to find anything and just chalked it up to some swelling in my eyes from the difficult delivery. At any rate, it was a few years later, I got better. I had a newborn and two toddlers at home, so I certainly wasn't focusing on this very small vision thing. And I think it did get better over time. But then I noticed I played a lot of tennis, and I actually got hit with the ball, and it started a little disconcerting because all of a sudden what had been a very fun, recreational and competitive sport for me had now become difficult. I was having trouble tracking the ball, and my timing became off. And so that's what brought me in to start. That was early 40s, and that's what brought me in to start the workup. And after not being able to correct my vision multiple times with glasses, then I saw a retinologist who was knowledgeable about the disease, luckily. And I do also just want to mention that out of curiosity, my mother had this disease. And so I think he knew also to look for it for me as well.
And Dr. Trosso, you mentioned that some of the changes that you started to notice with playing tennis, for instance. Can you tell us a little bit more about what has been the impact on your life of having MacTel?
Sure. So, I'm, as I said, I'm 55, so I've had this probably over 15 years, and it has been very slowly progressive. Although there are intermittent periods of time where things seem to get much worse, and then they seem to get a little bit better and falls back into the background. So some of the things that I have had progressively more difficult doing, things such as driving at night. I found that my depth perception isn't very good. And if there's a car coming on with their headlights, I can't really tell how fast they're coming at me. And so it makes me very nervous. And I also can't read, for example, the highway signs. If I'm driving on the parkway, I can't read highway signs because it's not a safe enough distance to get off of the parkway. So if I do have to drive at all anywhere that I don't know where I'm going, I always make sure somebody is driving with me. Although all my kids drive now, so somebody's always available to drive me distances. But what really became the biggest problem for me also was that I started having more and more difficulty reading on the computers. And at home, I could make certain modifications for myself. I have two huge computer screens, and I could make the font as big as I want. But at the hospital that I was working at, the medical charting systems, Epic, and we were using something else called Allscripts at the time, didn't really have that functionality. And I was finding that I was having a lot of trouble keeping up with my work because it took me twice as long to read things on computers, and things that should only be taking me a split second, where my nurse would walk in and see me with my face almost to the screen trying to read different things, or I'd be closing one eye and trying to read across. At any rate, this is a very long-winded answer, but in the long run, after many years of coping with this and refusing to let it define who I am, I actually have retired from clinical medicine because it just became that much difficult to keep up. And I was concerned about safety and accuracy, and just my overall health at this point. So I'm now in retirement and doing other things, which is lovely.
Mhm.
But it's a shame because I was an oncologist and I took care of cancer patients, and I just couldn't keep up at that rate anymore.
Mhm.
Yeah, thank you for sharing that. And I know, I can hear the passion in your voice and how difficult that must have been to walk away from that career. Thank you. Len, how about you?
Yes, thanks for sharing that, Tiffany. That's a really tough journey. And mine is similar, but a little bit different. It was, I kept going in annually just for the checkup through the retina specialist. And it was close to year 8 that I went in and he asked how I was doing. And I basically said, you know what? I'm really missing reading books. I can't read books anymore. We're around friends and they say, oh, you ought to read this book. You ought to read that book. And so I would try to pick up a book and read, and literally I would get a couple of pages in. I would keep turning my head to try to find a spot to where I could read it. Then my eyes would start burning and hurting because I was overstraining my eyes. Then I started finding difficulty performing work functions. As a consultant, we do a lot of Word documents, a lot of PowerPoints, and I create a lot of those. I really could not see those anymore. And I would work on it for a while and then I have to step away and do the work. I do a lot of work with teammates that are in other locations. So I told them that I was suffering through this, and I wanted them to know because they were so kind and they said, well, here, when I'm sharing something on the screen, let me enlarge it so you can see it. And so they really started, being very helpful to me to continue to do that work. I did have cataracts that were coming, and my retina specialist basically said, let's don't do cataracts until you absolutely have to. And at that 8-year appointment, he said, I think that we may be at a point where if you want to try to read again, let's see if removing that cataract can at least help. So I went in, had the cataract removed, and to be honest with you, I didn't see a lot better. My hopes were much higher than what my retina specialist actually conveyed, and I was disappointed. And I lived in that disappointment for a while. So right now I'm in year 3 of kind of semi-retirement, and now I can work maybe 5 or 6 hours a week on very specific things. It's not things that I have to read, but it's just more kind of helping the team out. So it's time for me to retire, but it's been hard making that transition, and I am starting to find other things that I can do to other than work that will be meaningful.
Mhm. Yeah, thank you, Len. And tell us a little bit, speaking of the transition that you mentioned and how wonderful to have supportive colleagues, but what have been some really helpful resources for you as you adjust to living with MacTel?
So what I would say, what I really had to learn to do, so I'm sitting in my office right now. I have a huge monitor in front of me. It's really big. I have my laptop open. I have my iPad. I have my computer glasses. I have my phone. And so sometimes I have to look at different documents. Somebody might be sharing something, but they'll send it to me ahead of time so I can look at it on my iPad. So to me, it's really getting the right tools in front of me, the right scale, getting the right fonts, the right background. And it took quite a bit of time trying to get those adjusted, because with that level of care and adjustment, I feel like I can still do stuff. I can't do quite as much, but I'm not totally incapable of doing it. So finding those little things that give you that comfort so you don't have that feeling of giving up is what's really helped me.
That's great advice, Len. It sounds like it was a little bit of a kind of trial and error, trying out a resource, see how it helps. Great advice. How about you, Dr. Troso? Any resources that have been super helpful for you?
Um, so I agree with all that Len said. I think, I'm a big Apple fan because everything is, you can make everything bigger, and I love my iPad that I can just with my fingers make things bigger. Sometimes I will wear like a yellow glasses over my regular glasses. And especially if I have to drive at night, that helps with some of the haloing and some of the glare. I also have a tint to my glasses that I use, my computer glasses as well, that helps to cut down on that glare. And I have special light. I don't know if you can see it. No, not gonna be able to do it. But there are special lights that you can order online on Amazon, where they have, you can increase the brightness, and then you can change the hue, because I find personally that having kind of a yellowish hue helps to counteract some of the strain on my eyes. Let's see, is that it? I don't know. I use binoculars when I watch my son play lacrosse so that I can see the numbers on the field. That's a little much, but yeah, those are some of the main things that I've done. And I agree, I have some very big computer screens that I use. So
Great advice. Thank you, Dr. Troso. And what would you say, you touched on a little bit of this, of course, with the resources, but any other advice that you would give to someone newly diagnosed with MacTel, something that perhaps you wish you would have heard or known about? What advice do you have?
So that's a great question, and I appreciate you asking me that, because it's interesting. The physician that treats me, he's wonderful, and I feel very comfortable with him and his care. But his office does not participate in any of the clinical trials, and so it wasn't until several years into my diagnosis that I heard about the Lowy Foundation, and I then was seen by a physician that works through them, and so that I could be placed on the registry, so that if some other clinical trial or treatment were to come up, that I would be, potentially in the running to be included in that. So I think that that's very important, to make sure that people are aware of that organization. And if something doesn't seem right, to make sure that they get another opinion. There are lots of doctors and very good ophthalmologists that don't necessarily know how to diagnose this disease. And so I agree with some of the statistics that were given earlier. I would bet that it's a lot more prevalent in the population than we're even aware of right now.
Wonderful. Yeah, get involved in research and encourage getting a second opinion too. Thank you. Len, how about you?
Yes. I think the hardest thing, so being newly diagnosed with MacTel, the thing that I had to wrestle with first was just acceptance that I had something. I didn't even know what the name of it was for quite some time. I love the fact that we now know what it is. It's MacTel. And I was really able to start describing that to other people, what it is, what I'm seeing or what I'm not seeing. And so just knowing what it is, also knowing that I'm not going to go blind, but that my eyesight will continue to be impaired as time goes on. But knowing what it is just the word acceptance. It really, really helps just to say, okay, I have this. And then the same thing that Tiffany said is having a trusted retinologist that you go to, that you trust. They know they're looking at out at your best interest. They know the research that's out there. They can give you recommendations. That's really, really helpful. The other thing that was really helpful to me is I really started sharing this more widely with people that didn't know that I had it. I kind of kept it a secret for a while. I didn't know how to describe it. I didn't know how to tell other people. So just being able to share, I shared it with somebody today that I saw, and I told them I was doing this webinar, and I was very, very excited to be a part of it. So, sharing with other people, sharing stories, everybody's story is a little bit different, but just knowing that there are people out there to give you some good advice, good recommendations. And then anytime you can participate in sharing the word, pointing people to websites, just helping other people to understand if they have this condition is always very helpful.
Wonderful advice. And to wrap up our conversation tonight, Len, what is your hope for the MacTel community and for the future?
So my hope is, I know that we have gone in a couple of times for FDA approval, and I think that there is a little bit of an extension on that time. So I'm hoping that this implant can get improved, and we'll have some successful case studies, and we'll continue to learn more about it. I'm very curious around the research side of it. What do we learn about this? Are there ever preventative measures or anything that we don't know about it now that we may know later that helps us to just be more aware of what's going on, and just continually, these types of forums, like what we're doing tonight and others, just having more opportunities like that for people to engage and to participate and hopefully share their stories as well. That's my hope for the future.
Excellent advice. Thank you, Len. Dr. Troso.
Oh, I completely agree with everything that Len just said. And one quick thing I want to just throw in there and then I'm going to go back to the question. If you're not on Facebook, you should join Facebook because there are at least one or two extremely valuable Facebook groups. I just want to give a little plug out there for it. And I would say so much of my knowledge and information has come through that group. And so I would highly recommend that you look into that. In terms of the future, especially being a physician and a scientist, I find it completely infuriating that I don't feel like there's anything I can do. And so that the more research that's out there and the more transparent the research that is undergoing can be for all of us who are waiting anxiously. A lot of us feel that, every minute that goes by that the implant isn't approved is another, molecule of loss of my retinal function. So I highly recommend that people, again, also use your networks to talk to people. Maybe we can get more funding. This is like an orphan disease. It's a zebra, but it's an important one because it's affecting people during their livelihoods. And it's something that I think if more attention was placed on it, that we would potentially be able to advance the science even faster.
Yes, agreed. Well, I want to thank you both so much, Len Palan and Dr. Tiffany Troso, for joining us tonight, for sharing your perspectives. It was truly informative and so appreciated. So thank you both so much. At this time, I'll turn it back over to Kira.
Thank you.
Thank you, Julie and Len and Dr. Troso. There were a lot of great nuggets in there to stay tenacious, to be curious, to engage in research wherever possible, to find community, and to find a way. And I think that's what we encourage everybody to take from this is there's a lot you can do to maybe do things in a different way, to find a group that can help give you the information you need. So a lot of wonderful information. I saw a lot of good questions come in, and we'll be able to touch on some of those here at the end of the session. Right now, I'm pleased to be able to share some resources that are out there for individuals with MacTel Type 2. One of which is a new resource that's been developed by Prevent Blindness. We have a new webpage and fact sheets and links to many resources on our website. The web address is preventblindness.org/MacTel. So you can go there and receive a lot of the information. That link will also be given again in the follow-up to this webinar for everybody who's registered. Additionally, we have a program that is led by the individual you just saw, Julie Grutzmacher. She leads our Aspect Patient Engagement Program. And this is a program that brings together individuals who have a range of different vision conditions. They're in different parts of their own vision journey, as well as those allies, individuals who are doctors or researchers or students who together want to learn how to advocate in different ways, advocate for your personal needs, to change in community access, to change in policy at the state or federal level. And it's an opportunity to meet a community of individuals who are all on that same journey and together learn how to craft your story and influence those to make a positive impact. It's a 10 meeting series, and then you have opportunities to connect with pharma companies such as those sponsoring the event tonight, to helping to influence FDA, to creating videos and stories and educational materials, and some have gone on to have their own nonprofits. So there's a lot of great impact from the Aspect program. And finally, we have another resource from Prevent Blindness, our Living Well with Low Vision web resource, which is a resource that is monitored, edited by somebody who does also experience retinal vision loss. And it's really about finding and providing resources for individuals who have vision loss, their care partners, as well as professionals to make sure that you can actually live a high quality of life. There's a lot of tips and personal poetry and stories, blog posts, as well as resources and guides to help individuals through that journey. So, as well as a transportation service finders, that's a big feature of that website. And finally, specific to this community, there is a new resource from Neurotech called Uncovering MacTel. And I want to encourage everybody to take a moment with the QR code that's on the screen if you have the capability, and we'll certainly send the link in the follow-up. But this is a way to be connected to a resource providing education, resources, and some of the latest information from Neurotech about their work in MacTel Type 2. And with that, I will pause and introduce Rich Small. We're pleased to have him here tonight. He's the Chief Executive Officer at Neurotech to take a moment and share a few comments with us. Rich.
Thank you, Kara. As Kara said, my name is Rich Small, and I'm the Chief Executive Officer of Neurotech. Just a brief description of myself. I'm actually in my work office right now, and I'm wearing glasses as well as a blue fleece jacket, and I am in my late 60s. I'd like to have a big thank you to Prevent Blindness for hosting this event for the MacTel Type 2 community. I found the discussion to be very informative, as well as I hope all the attendees have found it useful as I did. And in seeing the series of questions, I believe that many of you did. Just a quick word about Neurotech itself. We are a private clinical stage biotechnology company. We're actually located in northern Rhode Island, just about an hour outside of Boston, Massachusetts. Our main focus, we have a innovative sustained drug delivery system and are developing treatments for chronic retinal diseases. And our lead program is focused on developing a treatment for MacTel. And as part of our continued commitment to the MacTel community, we very much wanted to support this evening's wonderful Prevent Blindness program. And as Kara mentioned, we also very much encourage you to check out our Neurotech's disease education website, which Kara just talked about, which is uncoveringmactel.com. And I think I actually saw on the chat that actually the link was shared, where you can learn much more about MacTel itself. To learn more about Neurotech and the wonderful work we're doing, including updates on our programs, including our clinical programs, please visit our website at www.neurotechpharmaceuticals.com. Once again, www.neurotechpharmaceuticals.com. And once again, thank you, everybody, for attending this wonderful session.
Thank you, Rich, for your support, certainly, and for making tonight's education possible. It was a pleasure to have you here as well.
Thank you.
With that, I would like to welcome back Len, Dr. Trosco, and we'll deal with some of these questions. You guys have been wonderful out there in our viewing audience to provide us with a lot of questions, and hopefully we can tackle as many as possible. One that I really want to reiterate and make sure that both you, Len, and Dr. Troso have the opportunity to really touch on the importance of this for you is how you became aware of or become just educated about clinical trials. There's a lot of interest and I can see from the questions, how do I learn more? How do I get engaged? How would I get connected to research? What did you experience or the steps that you've taken to become involved in research? Dr. Troso, you want to start?
So I'm in New York, and like I had mentioned, my retinologist does not participate in any of the clinical trials. So I actually flew down to Miami. Um, Long story, but my brother-in-law was there, so it seemed to make sense at any rate. And I was seen there, and so that's how I was enrolled in the registry, so that I could potentially learn about more clinical trials. There's also a website that we use in medicine that anybody can access, in terms of looking at clinicaltrials.gov. And you can actually put in your disease and what kind of trial you're looking for, and it will actually show you the trials that are available across the United States. You can also limit it based on distance from your home. So it takes a little bit of it's a little learning curve to figuring out how to find what you're looking for, but it is certainly available to everybody. And I'm sure, if I haven't looked, but I'm sure there's a YouTube on how to use it if you need it. I think that that's probably the central way for physicians and other people to find clinical trials across the country.
Len, anything to add?
Sure. For myself, I was really very fortunate. My retinologist is involved with research, and so I became very informed on what was going on. And just, I think that having that understanding of what's going on and knowing that he was involved with it and that I was getting some good advice. And there are times you would say, so Len, let's just wait a little bit longer. This is what's happening. You're in a good spot right now. So having a retinologist that is involved with the research gave me a lot of comfort that I'm in the right spot and getting the right type of guidance. So I've been
Right.
very fortunate.
Right. Sounds like you have a good, strong relationship there.
I'm in
And
Michigan.
for the resource I mentioned on preventblindness.org's /MacTel, we do have a link to clinicaltrials.gov and some guidance to help you get to those clinical trials around MacTel as well. So there's a couple of different ways to support people finding that clinical research, and also having that strong positive relationship with your provider is important as well. And Tiffany, I don't blame you for heading towards Miami. It's getting to be wintertime here in the Northeast and Midwest. Any excuse to go to Miami is just fine with me. So you've mentioned different family relationships and going to see your brother and your children and how they're supporting you. Can both of you talk a little bit about the impact that having MacTel Type 2 has had on your family and social relationships, if any? So how are you guys navigating that section?
From a family perspective, I think, and I mean, it happens every day, so it doesn't really ever go away. We may be driving somewhere and I'll just say, oh, I can't see that. Can somebody, I mean, I can see to drive, but I can't read a sign. So I'll actually have to ask them, can you tell me what that street is that's coming up? I can't quite tell. Even my wife will say, hey, Len, look at this. And she'll show me something on her phone. And I'll say, remember, I can't see that. And so, it's having to have another set of eyes that can help you see that kind of stuff. And I think my hearing isn't great either. So literally, when your eyes are not great, you really have to depend upon your hearing. So it's just like, so I just have to really be very careful that I put myself in situations where I don't start feeling isolated because I can't see or I can't hear. And so I just have to really use my family and use my friends that understand it to kind of help be the second set of eyes when I need it.
Very good. Tiffany?
I 100% agree that, I always have somebody riding shotgun with me in the car if I'm going to be driving. And as I sit very close to the sports field, and I usually will tell everybody around me, I'm sorry, I'm going to be asking you where my son is. If you could just help point him out, because usually once I find him on the field, or my daughter, I can follow them, but sometimes it's hard to pull them out. Yeah, and I think the most frustrating part about all of this is that it's really hard to describe what's wrong, why you can't see. And it's, I wish that there were better, we had some photos earlier of what it kind of looks like, but it's really difficult to explain it to other people. And, even by just giving them like, well, I'm 20/50 in my right eye, nobody really gets exactly what that means. In terms of my family, though, I have to say that I feel a lot of guilt and worry and concern because I have 3 kids and I feel like, well, I got this from my mom. And so there's a pretty good chance that I will have passed it on to at least one of my children. And, they're too young to necessarily go for screening for this test, but as soon as we get a little farther along in the genetics testing, it would be really nice to know earlier. I'm constantly at them like, put your sunglasses on, protect your eyes. Are you taking your vitamins? Because I want them, to have the healthiest eyes that they can in case they are going to eventually be facing this.
Oh, wow. And it's good just to do that in general. Make sure they're taking their vitamins and wearing sunglasses. But all the more
Sure.
reason to hit it hard now and to be involved in research so that we have solutions should they
Yeah.
test positive during that genetic testing. A popular question I've seen at least 2 or 3 times now. Are you guys still driving then?
Yes.
Yeah.
Huh?
But
And
limited.
any particular time of day? I know Dr. Trosa, you said earlier that nighttime is hard for you with glare. Any other limitations that you have?
So,
Uh,
I did have a cataract removed, and so the cataract does help, even though you don't have, it takes a little bit of you can see better was with cataracts off. I really try not to drive at night, and especially if it's rainy or the road is wet and it's kind of hard to see lines. I just ask my wife to do the driving, but daytime is pretty easy when I know where I'm going.
Perfect. And generally people are happy to help. So I'm glad that you both speak up and say what you need. It's part of that advocacy again. Letting people know what you need is really critical. So thank you for that. Couple of other questions that we've had. I saw one in the Q&A come through. Was there any recommendation around mental health support or discussion with a counselor as you're having these vision transitions occur? Or do you have a feeling about how that should be approached in vision conditions such as this?
Well, I could certainly say that as my vision deteriorated and I was having increasingly more difficulty in my career, um, I sought out counseling myself because, I was 55 is a little young to retire from being a physician, but I realized that I could potentially use my skills and my expertise in another way to help people. And so that's what I'm looking to do now. But I don't know that I would have made that whole transition so easily or not easily, but if I hadn't had a professional to talk this out with. But no, nobody had ever mentioned to me about having counseling. And sometimes I just try to just shove it in the back and just carry on, buckle up and carry on. And sometimes I've cried and I've pounded on the table and said, why me? This isn't fair.
Yeah.
So it's a whole range. You get all the emotions with it.
As you should. Len, have
Yeah.
you had any experience in that realm?
I have not sought out any professional counseling on it, but I agree with Tiffany. There are times where you say, why me? And then you get very frustrated with it. And when you know you can't do something about it. And so it has just, I think that since I've been living with this for 10 years, it's that acceptance word. Finally, I can accept it. I don't get as devastated by it. And again, I think, and I know Tiffany, you had to kind of end your career a little bit earlier than what you had hoped. And so I'm lucky that I was kind of on that swing towards ending that. So I think that finding other meaningful things to do in my life, whether it be mentoring others or helping others, how do I give back to other people? Even though I have this limitation, doesn't mean that I'm not valuable to helping others.
Yeah, there's a wonderful quote that has stuck with me in one of the meetings Julie led for Aspect. It was an individual that said, you can still do things, you just might do things a little bit different, and that's okay. So thank you both for sharing a big part of your life and a lot of wisdom. There's a lot of people saying thank you in the Q&A and the chat. A feeling of community has been given tonight. So thank you for providing that for everybody. I want to thank all of you out in the audience and again the support of Neurotech for making this possible tonight. I hope this has been helpful. Please use those resources, make the connections, be tenacious, ask questions, get involved in research. It'll help drive all of this forward for everybody. With that, I wish you all a good night and good evening. Take care.